Hello, everyone. We are thrilled you could be here with us today. We are really excited. As you know, our Visiting Vignette series is a series where we give the patient perspective on all types of different diseases and conditions. And today we are partnering with the National Blood Clot Alliance, and we have Leslie Lake here, President Leslie Lake, to talk to you a little bit more about blood clots. And so Leslie, again, is the president, and she will tell you her story. So I will not be introducing her, but she will tell you her story today. And we would like to thank Bristol Myers Squibb for their educational grant that allowed us to bring this to you today as well. So I'm going to stop sharing my screen, and then I'm going to put Leslie and I on it. We're going to have a conversation. Okay, thank you so much, Leslie, and we really appreciate you being here today.
Well, thank you for having me. I'm thrilled to be here, and it's, as you know, Blood Clot Awareness Month.
Yes, I know, which is exactly why we were doing this month. So we are really excited to partner with you all and help create awareness of blood clots. So on that note, can you tell us just a little bit about your story and about how you were impacted by blood clots?
Absolutely. So, I live in New York City, and it was June of 2018, and it was a beautiful sunny day. And I was supposed to be giving a speech that evening. I work in finance, and I was excited about my speech, and I was coming back from the dry cleaners and coming up a little incline. And all of a sudden I had shortness of breath to the point where it felt like somebody was just choking me and choking off my air supply. And it was terrifying. And it happened so very quickly. It was so bad that I actually had to hold on to like the side of a building because I thought I was going to pass out. And I managed to get my way back to my apartment. And obviously at that point, my heart rate was really accelerated as well. I was having a hard time breathing. And I, through a series of, missteps, probably, I finally ended up in the emergency department at a local hospital. I think women, we have a tendency to say, oh, it's nothing. Oh, it's this. Oh, I need to get back to the gym. And we really need to take our health very seriously. And so I went into the hospital, into the emergency room, and, unfortunately, I kind of displayed, if there are classic symptoms, shortness of breath is one of them, accelerated heart rate is another one. And the day that I went, I actually had my period, and they were quite fixated on this in the emergency department. And I ended up having several gynecological exams, which has absolutely nothing to do with a blood clot. And they were thinking about actually letting me go home that evening. It was about 9 hours after I had actually presented at the hospital. And before they were going to let me go home, they decided to do a scan of my lungs. And at that point, that's when they came back to me and said, you have a blood clot. The next thing I knew, everybody was very serious. Like the tone in the room changed dramatically, and I was being rushed to the ICU. I'd never been in the hospital before. I'd never been to the ICU before. It was a really scary, frightening thing. And so that was how I started my whole journey with blood clots.
Wow. Well, it sounds like the whole thing was a surprise to you, but what would you say? And then I want to ask what they did about it so people know how they treat blood clots. But what would you say surprised you the most about that whole experience?
So I guess for a couple of things. One for me is, I had heard the phrase blood clot before, but I never really knew what it was. I had taken hormonal birth control years before, and, there was a comment about blood clots, but it was never really discussed with me. And then, the urgency, once they figured out that I actually did have a blood clot, and moving me to the ICU. But they brought me to the ICU. I was, connected to, a blood thinner, which was administered through an IV. So they use low molecular weight heparin on me. And that prevents another blood clot from occurring, but it doesn't actually help the blood clots that are in your body at that point in time. And I was surprised when I look back on this at the lack of discussion about what was happening and why they were doing certain things. There never was a conversation about this is what's happened, this is how we're going to treat it.
Wow. Well, do you feel like, so it seems like that may be common. Do you feel, in your experience, do you hear a lot of patients who are misdiagnosed or not properly diagnosed when they come in with that kind of symptom?
Absolutely, absolutely. We hear it very often. That's one of the reasons why we are so anxious to partner with you folks so that we can raise awareness and we can share signs and symptoms. It's just, there's a very low understanding of blood clots, not just by the general public, but also with healthcare providers as well. Studies show that about 6% of the American population actually knows what a blood clot is. And that's really pretty terrifying when you think about how many people actually get blood clots. I mean, 100,000 people a year die from this, almost 1 million people a year get it. For women in particular, if I present at the hospital with the same symptoms as a man, I'm going to have a much worse outcome than they are. So women we're not taken as seriously. We're not as aggressive about our health. I mean, look at me. I tried to blow it off, and then I finally got to the point where I knew I couldn't blow it off. So just really encourage women to, take control of their health.
Well, it's amazing to me that you went in with shortness of breath and you're having gynecological exams, because I don't really know of gynecological conditions that cause shortness of breath.
No. And, I can kind of laugh about it now, but it's not funny.
Yeah.
I could have died. And this was at a major, metropolitan hospital. It wasn't like I was in the middle of nowhere. I was actually in New York City in 2018, which really wasn't that long ago. It took them a while to figure out what was happening.
Yeah. And so people know that are watching today, what are some of the other risk factors to getting a blood clot?
Yeah, so there's many risk factors. So as I mentioned before, hormonal birth control can be one of them. Hormonal replacement therapy can be one of them. If you have a family history of blood clotting, if you've had surgery, knee surgery and hip surgery are prime candidates actually for a blood clot. If you're pregnant, if you're post-pregnancy, up to 3 months after pregnancy, smoking, being overweight, being dehydrated. I mean, there's just a huge list of risk factors. In my case, I had been relatively sedentary, working at my desk for a long time, and that may have contributed, but they don't know. And so I'm what's referred to as unprovoked, which is just kind of a fancy way of saying, sorry, Leslie, we don't actually know why you got this. But you did get it. And so now that I have it, I'm obviously predisposed to getting one again. So I'm on a regimen of blood thinners probably for the rest of my life.
Right. It is amazing how prevalent they are and how many people have them and how many risk factors there are for them. And yet people don't know when to look for the signs and symptoms of having one. And so I imagine that, if you had things that you really want people to know about this, first of all, let's dispel a couple myths. Well, let me backtrack a little bit. Can you briefly tell us, just so everyone knows, that what the difference between a DVT and a PE and what they are?
Sure, absolutely. So a DVT is what's called deep vein thrombosis, and that is a blood clot that forms usually in a leg vein, but sometimes can be in your arm as well. And in that instance, quite often a patient will have, pain in their calf. There could be swelling, there could be redness associated with it, and a pulmonary embolism, which is referred to as a PE. And a DVT plus a PE is what's called venous thromboembolism. And so there's two kinds. There's the DVT and the PE. What happened in my case is that somewhere I had a blood clot, and it could have been in my leg, and a piece of that broke off and went into my lungs. And that's what's called pulmonary embolism. It's very, very dangerous. As I said before, 100,000 people a year can die from this. About 30% of the people who get one, unfortunately, the first symptom is going to be immediate death. So it has a very high mortality rate associated to it. And the sad part is that blood clots are highly preventable with more awareness and education efforts.
Yeah, and again, that's why, we're here today together, because we really want to raise awareness of this issue so that we can save lives. And I know you guys do tons of wonderful advocacy work. You're in DC now, and
Yes.
and working with policymakers to raise awareness of this. And so with all of that, I'm going to ask you two questions, and I apologize for doing this in a row. What are some of the myths about blood clots you would like to dispel or clarify? And what do you really want people to know? At the end of the day, if you could name one or two things that you want people to know, what would that be?
So myth number one is that it only happens to older people. There's a higher incidence as people age of getting blood clots, but truly a blood clot can happen to anyone, regardless of your age, regardless of your sex. If you're male, if you're female, it does not matter. Absolutely everybody is at risk of getting a blood clot. So I think that is myth number one. I think there's also an element of people think they get it flying. And while being sedentary is obviously a risk factor, it doesn't mean that you're necessarily going to get one because you fly, but you should be aware of it because you're flying, particularly if you're going, long distances. So there's an element of people think, oh, it could happen to me if I fly in an airplane a long distance. Yes, it could, but that's not the only way that it happens. And also that it only happens to, younger people, older people. You mentioned being in DC. I'm here actually today, and we're trying to raise awareness with members of Congress. Joining me today was a young woman by the name of Katie Hoff. She was an Olympic swimmer. She works with the National Blood Clot Alliance, and she was in her 20s when she was misdiagnosed. And here's an Olympic athlete training for the Olympics, who even that amazing medical team around her missed her diagnosis: shortness of breath, chest pain, back pain, pain in her ribs. Misdiagnosed it, and it ended her swimming career.
Wow.
So she's lucky to be alive, but here's a healthy Olympic athlete who gets a blood clot.
Mm-hmm.
So truly it can happen to anybody.
Yeah, well, that is good to know, because you do hear these things about being on a plane or different things that could cause it. And there is I agree that at any age, we need to be aware of this, because we can be doing things that put us at higher risk, and especially with some of the accidents and crush injuries and hormone replacement.
Absolutely.
So when you were diagnosed and just learning about it, what are some of the questions that you had that you just wanted to know and wanted answered?
Yeah. So obviously, I knew nothing about the medication that they had put me on. I didn't know what an anticoagulant was. And I have just to take a step back for a little bit. So when I was finally released from the ICU and when I was allowed to go home, I literally left without any information whatsoever, which is also really frightening. And so, sadly, Dr. Google was my first follow-up appointment. And I was a person who knew that I had just suffered a potentially life-threatening experience. And oh, by the way, you're at the greatest risk between, 0 and 30 days. Nobody spoke to me about the fact that I was on an anticoagulant and I had my period. So you have much higher bleeding rates, obviously. But nobody spoke to me about my anticoagulation. I had to learn a lot of that by myself. What did that mean? Were there certain foods that I could eat? Were there certain foods that I couldn't eat? Could I have an active lifestyle? It was, and also just mentally. It really takes a toll on people, and we want people to know that that's normal to experience that. A majority of people actually suffer from PTSD after their blood clots. So yeah, it was a tough journey, and I eventually found my way to the National Blood Clot Alliance, and it was a lifesaver, because they were like, here's everything that you need to know. And it made me a much more educated patient, and allowed me to really get my arms around my health journey.
Yeah. And That is so important to be, you all and we at Mended Hearts want the empowered patient. We want
Yes,
people to be able to take control of their own journey, and you certainly have done that, and you all do that. In
it's
terms
hard.
of, yeah, it is
You know,
hard.
it's
Yeah.
And I'll just, I'll add one other thing. So, I referenced the fact that, quite often women get a little bit of the brush off.
Mhm.
And I think I did initially. I was treated for an unprovoked blood clot, but the protocol that was recommended to me was actually incorrect. And I only was able to find out because I was doing my own research on this, which is a terrible, terrible position to put a patient into. So I'm unprovoked, and the data is very clear. You should stay on an anticoagulation probably forever, because if you've had a blood clot, you're at a significantly higher rate of having another blood clot, to the tune of 30% within the next 10 years. I didn't want to be part of that 30%. And
No.
so, I learned from NBCA that, hey, you should have a conversation about staying on the blood thinner with your unprovoked diagnosis.
It is amazing how many times that patients have to find information for themselves. And luckily, we have good organizations with great
Yes.
information, but there's a lot of misinformation out there. Can you talk a little bit about what you use to find reliable information, like what you would suggest to others when they're trying to look for reliable information?
Yeah, so in my case, obviously I found my way to the National Blood Clot Alliance. We've been around for a long time, so finding an organization that has, been out there doing this for quite some time, your organization is like that, our organization is like that. And also the patient advocacy piece of it is really important, because I was able to connect with people who had experienced what I went through, and to have somebody else say, hey, I went through this, learned from my experience. I want to pay it forward to other people. It was so invaluable. We've created a new patient guide for people when they're or recently diagnosed with a blood clot. I was never given that. And so it's a great, great, handout to give people. And I see on we have this peer-to-peer patient group where people that are coming in that are newly diagnosed talking to us about their experience. And it's just heartbreaking. Like, you want to just go through the computer and help them and say, it'll be okay. Here's what you need to know. And quite often I see them coming through, in the middle of the night, because, they can't sleep because they're so stressed out about what has happened. So, finding a reputable group that's been around for a while, that's really focused on the patient, I think is really important for people. It helped me so much.
Yeah, I mean, it is, so we often see middle of the night as well.
Yeah.
It's the late at night when the gremlins come in and you can't
I
sleep.
was there. I was
Yeah,
there.
yeah. Can you talk to us a little bit more, and then I'll open it up for questions, about living on a blood thinner and other lifestyle changes you had to make?
Sure. So when I was first diagnosed, they put me on a very high dosage, because they wanted to make sure that I didn't have another blood clot. And so your body actually gets rid of the existing blood clots by itself. So the dosage that put me on initially was very high. And it did impact my life. As I said before, I had my period, was super heavy because of the anticoagulation. Nobody told me that that would happen. There were certain things that I couldn't do anymore. They didn't want me riding my bicycle. In my case, I was on what's called a DOAC, which is a direct oral anticoagulant. So I'm on a pill. And if you're on different forms, it can impact what you actually have, in terms of your diet, because of the vitamin K influence. But on DOAC, it's pretty well, documented that you can eat whatever it is that you want. Over time, they put me on what's called a maintenance dosage that I take every single day. But again, they don't want me doing things like going skiing, and they would prefer that I don't ride my horse, and, things of that nature. And everything is about a risk reward balance. But I have to say the DOAC allows me to lead, a pretty normal life. If I'm flying long distances, my dosage might be increased. But the big concern with anticoagulants is bleeding, because that's an issue, and unfortunately it can cause death. if it's not treated right away. And there are reversal agents, but you have to make sure you have access to them. So people just really need to better understand what the anticoagulants do, how they work, how they interact with food or not. And these are all questions that, should be asked and answered by your healthcare provider. But it doesn't mean that you can't lead a very, normal life. And I do almost everything that I did before. So I'm thankful that they exist.
Yeah. It is, we are so lucky with all the different treatment options that we have these days. And we have a question that came in, but I want to tell you all who are watching, you can type your questions in the Q&A box as well. And the question is, how did you decide what kind of blood thinner to get on?
So that was initially decided for me when I exited the hospital. So I think I mentioned before I was, hooked up to an IV, and that's how it was administered initially. But when I left the hospital, I was actually on one of the DOACs, and I actually, believe it or not, had some reaction to it, and which can happen. People get reaction to different DOACs. It's like any other drug. And so I went to my doctor and I said, hey, I don't think this is normal. And initially they said, no, you're fine. You don't need to switch. And after everything that I had gone through, I said, no, this isn't normal. And, I've been doing my reading and I've been doing my research. And they said, okay, we'll switch you over to a different DOAC. And then that worked great. So for whatever reason, the first one didn't work well for me, and the second one did, and that's been 4+ years now.
That's excellent. And it does help to know that if something isn't working for you, you can always try something different. You are not stuck with any one treatment option.
No, and I know sometimes, and this is not to fault the clinicians, but they're treating the acute, so it's the initial incident that has happened, and people respond differently to different drugs. I know in our peer-to-peer groups, we see this a lot actually, that people have reactions to the drugs, and it's just, you have to go back to your clinician and say, hey, this didn't work for me. What else can we try?
Yeah. Gretchen asked a really good question. She says, can you talk about who should be on your healthcare team, or will a PCP, a primary care provider, be able to manage your treatment? That's a great question, Gretchen.
Yeah, that is a great question. So, and it takes a big team. So initially, you want to make sure that you have a hematologist, which is an individual who basically checks your blood and runs all kinds of tests on you. In my case, I also had a pulmonologist. So that's a person who oversees my lung activity. So I had a pulmonologist, I had a hematologist, and I think it's really important that you have a specialist, because a lot of doctors aren't well versed in this. Like the question about the anticoagulation, a hematologist would really know the answer to that. They would work with you specifically on that. In fact, my PCP was brought into that conversation about which drug should I be on, and she's not an expert on it. And she was like, this is really something that the hematologist should be focused on. So in my case, I ended up with my PCP. I had a hematologist and I had a pulmonologist. As time has gone by, and I'm more of a maintenance situation, I'm with my hematologist as opposed to a pulmonologist.
Yeah, well, that's very helpful, because sometimes I think people try to manage it on a level they shouldn't be managing it. And so it's really helpful to know who to go to. And we have time, I think, for this one last question. I'm making sure there's not another one. They just are asking how often you had to get your blood tested, how often you have to get tested on an anticoagulant.
So when you are first diagnosed, they take more blood and do more tests. I didn't realize I had this much blood in my body, quite honestly. I mean, it was vials and vials and vials and vials of blood and all kinds of testing that they did on me. And then as time went on, it really has turned into a maintenance event. So once a year now, I don't have to get my INR tested because I'm on the DOAC and I'm within, certain ranges. And So I'm thankful for that because, some people do have to get tested on a pretty regular basis. But, after the first year, it really went to kind of an annual exercise.
Okay, well, that is good to know. I feel like I could talk to you all day. This is
And I can talk
fascinating.
about blood clots all day. So
Yes, I know, I bet. Well, it's so interesting for me dealing with all kinds of different heart disease to sit down and talk with you today. And this for all of you who are watching, and this will be recorded, and we will have the recording on our YouTube channel, and we will send that out as well. So you're lucky enough you'll get to share this information with friends, and it can save a life. It's really important.
absolutely.
Leslie, is there anything else? I just appreciate this so much. You've been wonderful. Is there anything, last words you would like to give?
Yeah, I would. You know your body better than anybody else. And if something doesn't feel right, it usually means it isn't right. And so in my case, I initially didn't want to address it, but I'm really glad I did. Because if I hadn't, who knows what would have happened. And even with my issue in the emergency room, I was eventually diagnosed correctly. And in particular, for all the women out there, don't let anybody brush you off. It's your health. Focus on it. Take care of yourself. If something doesn't feel right, push the envelope, find a new doctor, call the National Blood Clot Alliance. We'll make sure you find somebody, but take it seriously and really listen to your body because it can be the difference between life and death.
Absolutely. Wonderful words of advice. And again, thank you so much. This has been phenomenal. I really was
Welcome.
thrilled to have you here today with us.
Thanks for having me.
Bye, everyone.
Bye-bye.